Good day, I'm Dr. Dale Dangleben, and on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel, the topic of the day is fibroids. I want to exchange, sorry, I was having some breakfast here. I want to talk about fibroids in black women, understanding it, recognizing it and managing it. It affects millions of black women worldwide, right? And it has a significant impact on black women. It's a non-cancerous growth, right? But it can grow to the point where it puts pressure on the uterus. It puts pressure on the surrounding structures. It becomes painful, and it really affects women's health and the quality of life, right? And also their fertility, right? Even if it's common, it's overlooked, and we know why it's overlooked. So we have to shed the light on it, right? And not, normalize it, right? And let's understand it. So this misunderstanding in our communities, we can overcome that ourselves. We don't wait and depend on other folks to educate us, right? So studies have shown that by age 50, up to 80% of black women will develop fibroids, much lower for other races, right? And again, these fibroids tend to be larger and more symptomatic. The reason is not fully understood, although again, genetic implications, hormonal factors, and always talk about lifestyle and environmental exposures, right? And that's important. And I had touched on vitamin D deficiency because we've been miseducated and misinformed about vitamin D and melanin. Vitamin D deficiency seems to have a correlation with fibroids, right? So you have decreased vitamin D production in black women. All right? How do they form? Fibroids form within the muscle of the uterus. All right? And like I said before, the exact cause is not known, but there is influence from the female hormones, estrogen, progesterone, right? And they grow during your reproductive years and tend to shrink after menopause. All right? The risk factors that are listed are family history of fibroids, early onset of menstruation, obesity, especially morbid obesity, diet in things, red meat, lots of red meat, and a diet low in fruits and vegetables. All right. The signs and symptoms: heavy or prolonged menstrual bleeding. That in itself leads to anemia, which is low blood count. You get fatigue. You get weak. You get pelvic pain, pelvic pressure. All right, and all with that feeling of fullness and heaviness in your lower abdomen. Because of the pressure on the bladder, you have frequent urination. All right, pressure on the rectum, so you have constipation, painful sex, and difficulty getting pregnant or recurrent pregnancy loss. All right, so these are the things that we have to pay attention to. See your healthcare provider. Okay, and the healthcare providers need to be on top of the game in helping black women navigate through this. Order the ultrasound. If it's very complex, get an MRI. All right, these will give you as much information as possible. All right, and let's focus on the management of these fibroids to reduce the pressure, reduce the pain, and also to help with fertility. Right, so medications that's being used, the hormonal birth controls, will help control the heavy bleeding. Does not necessarily shrink the fibroids. There is medications such as TXA, which is tranexamic acid, which women can take if they have heavy menstrual bleeding. And there's hormonal medication, other hormonal medications that can temporarily shrink the fibroids. That's usually given by the physician, the surgeon, before surgery, And I always encourage iron supplements during those years because of obviously anemia. All right. There's a lot of things that can be done. There's embolization, there's MRI guided ultrasound waves, but usually it comes down to surgery. You can have just the removal of the fibroids and preserving the uterus. That's for women still wanting pregnancy. That's called a myomectomy. Okay, in very severe cases, and if the woman no longer desires pregnancy, then you could go ahead with a full hysterectomy. So these are the surgical options that's out there. But lifestyle and is key. There's things that you can't prevent, but when you get it, you can navigate through the signs and the symptoms to get a better lifestyle. Right? Increase fruits and vegetables. You can never go wrong with that. Reduce the amount of red meat you consume. Go to your OB-GYN for your regular checkups and address the symptoms. Don't hide your symptoms from your doctors. All right? And have them check your vitamin D at least once a year and keep up with that. All right? So fibroids are extremely common in black women, but suffering in silence is not necessary. All right? If you notice heavy bleeding, pelvic pressure, your fertility challenges, speak up, get checked, and explore your options. Remember, knowledge is power, and the earlier we act, the more choices we have. This is about educating each other and not waiting for others to do it for us. I'm Dr. Dangleben on behalf of Patient Choice. Have a great day. Peace.